Welcome to the Afterspin, opinions from thought leaders in our state. John Hood, State Auditor Beth Wood recently released an audit that showed CCNC, or Community Care of North Carolina, was indeed saving the state money on Medicaid recipients. Now, the John Locke Foundation and others have been critical of this agency. Does this audit justify their existence and continued funding by the state?
Well, it shows, based upon the data that were analyzed, that counties that had this system earlier than counties that adopted it later had somewhat better cost containment in some areas. There were lots of experts that looked at the study, thought it was okay, but didn't really, for example, didn't pull federal data that showed a different set of outcomes, didn't compare North Carolina to other states. It fundamentally didn't answer the real question. I mean, the debate is between should you have pay-for-service, fee-for-service, unmanaged Medicaid, or should you have medical homes? The answer is medical homes. It might save you a little bit of money. The real dispute is about whether medical homes is a better option than more tightly controlled provider-led networks or commercial managed care companies, and this is not what the audit was designed to answer. Maybe the audit should have answered a different question, but it didn't.
But the legislature hired the company and gave them their marching orders for doing this audit.
Not the well, this is a state auditor's office.
Okay, well, didn't the legislature
it was authorized. I'm sure the study was authorized. And I think the study is interesting. One of the most important things about it, if you go and look at if you go past the executive summary and read the study itself, one of the things that surprised me is that it did not have any effect. Medical homes didn't. The CCNC system didn't have any effect on emergency room visits at all. Now, there was some reductions in hospitalization. I assume this is because of people who have chronic conditions that went to primary care physicians rather than being admitted to the hospital for scheduled surgeries or something. But actually, emergency room admissions do not appear to have been affected by the program, which did surprise me.
Interesting. Well, thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.